What exactly is chronic pain? Simply put, chronic pain is pain that lasts more than 3 months or past the time that an injury is expected to heal. For example, after a car accident, it makes sense to have some amount of low back pain immediately afterwards. We call that acute pain, pain that has a known cause and is short-lived. We expect this pain to get better, and for most of us, it does. But in chronic pain, the symptoms don't go away. They linger and begin to interfere with other aspects of our lives. There are many causes of chronic low back pain as listed here. We're not going to cover all of these conditions. Instead, we're going to focus on the 3 most common causes of low back pain. Since this discussion is not comprehensive, we encourage you to talk with your healthcare provider if you have additional questions or want a formal diagnosis. So today, we're going to focus on muscular pain, arthritis, and pinched nerves. The first type of pain we will be discussing is muscular pain. We will be spending most of our time discussing this because it is the most common cause of chronic low back pain. Most cases of muscle pain occur when the muscle is strained or injured, like with lifting a heavy object or being in a car accident. In these cases, once the muscle recovers, the pain goes away. However, many people experience muscle pain that won't go away. This is particularly true if people have weakened back muscles due to inactivity, constant muscle tension due to increased weight, emotional stress, or underlying spine conditions like arthritis or pinched nerves, or muscle overuse due to overactivity. Chronic muscular pain can present in 2 ways. First, chronic muscular pain can occur after prolonged activity. For example, this is low back pain that occurs after spending most of the day doing housework. This feels like cramping, aching pain that may travel up the spine a little bit, down into the buttocks or side to side, but it doesn't travel down the legs. The pain usually gets better with resting, ice or heat, and stretching. Second, muscular pain can present as episodes. In other words, you may not have pain every day, but there are times when your back gives out. During these episodes, the back stiffens up right away and takes a few days to loosen up. During that time, the only thing that helps is rest, ice, and a light massage. Once the episode resolves, the pain is minimal until the next episode. In both situations, many people will actually feel their back muscles as tight, rope-like cords, which goes hand in hand with the feeling of back stiffness. The pain is typically better with rest and lying down. However, for some, too much rest can cause the muscles to tighten, worsening their pain. The same thing goes for activity. The pain is typically better with exercise and stretching. However, for some, too much exercise causes muscle pain. Muscle pain is typically a clinical diagnosis, meaning imaging is not required. If you experience your back giving out, the good news is that it typically resolves with time. In fact, more than 50% of cases will resolve itself in 4 to 6 weeks. The treatment plan for chronic muscle pain, regardless of if your pain is constant or if you have episodes of your back giving out, is to keep active and don't allow yourself to become deconditioned. So managing chronic muscle pain means figuring out how to keep your muscles engaged while avoiding inactivity or overuse. Pain Navigator will get you there. By identifying where you might be caught in the vicious cycle of pain, establishing a SMART goal, and learning how to reactivate your muscles, you'll be able to prevent muscle pain from getting in your way. Next, we'll be discussing a degenerative condition called lumbar spondylosis. Spondylosis is another word for bone spurs and arthritis that forms in the spine. When these bone spurs form around the facet joints in the back of the spine, it can cause a narrowing of the joint space. Spine arthritis is typically caused by increasing age, wear and tear, as well as chronic physical stress. Just like chronic muscular pain, increased weight, poor posture, and increased inactivity can cause the joints to rub against each other, accelerating arthritis and bone spurs. When arthritis develops, people can experience a range of symptoms, depending on how able and ready their muscles are to compensate. In other words, some people may experience pain from arthritis, while others do not. The most common symptom from arthritis is stiffness. This is usually after prolonged inactivity, like after sitting in front of the computer for too long, or when someone first wakes up in the morning. Once the muscle becomes engaged, like after stretching, the stiffness will resolve. People with pain symptoms from arthritis will experience low back pain, which stays in the back and upper buttocks and described as aching and dull. The pain is worse first thing in the morning after prolonged immobility and can also be worsened by twisting side to side. The pain will typically improve with stretching and exercise, which usually happens as the day goes on. In some people, the bone spurs will grow into the spinal canal, which can result in the spinal cord and its nerves becoming pinched, sending symptoms of pain, numbness, and tingling in the legs. Since arthritis does not result in pain for most people, there isn't a need to get imaging unless it is causing severe pain. In most cases, it is suggested to get an X-ray, CT, or MRI only after trying conservative therapies like the ones we discuss in Pain Navigator. As I mentioned, the pain may be worse in the morning. Some people stuck in the vicious cycle of pain may decide to stay in bed to avoid making the pain worse, but not you. If you know your pain is worse when you first wake up, start stretching while in bed. Like you'll learn in our exercise modules, once your muscles are activated, you'll start to feel better. You'll find it's easier to get out of bed and get going. The same thing goes for sitting. If your arthritis pain kicks in while you're watching TV, make it a habit to stand up and stretch during commercial breaks. Or, if you're stuck in a string of virtual meetings, take some time to turn the camera off, put the headphones on, and stretch. If you don't take care of your back now, your work productivity may suffer later. The last condition we will discuss in this module are pinched nerves of the spinal cord. A pinched nerve can occur due to bone spurs, as we mentioned, or if the discs in the front part of the spine start to push towards the spinal cord and its nerves. Most of us have heard of people suffering from pinched nerves, either by the name of stenosis, which just means narrowing of the spinal cord, or more commonly as sciatica. Most commonly, a pinched nerve occurs when the disc is worn down due to age and wear and tear. But there are times when discs can herniate and really push into the spinal cord and its nerves. This can happen after an injury, improper body mechanics, or trauma such as a car accident or a fall. Like all chronic conditions of the spine, poor posture, improper body mechanics, and excess body weights are big risk factors for pinched nerves. Other risk factors include physically demanding jobs which require repetitive lifting, pulling, pushing, and bending, and smoking. In fact, people who smoke are more likely to wear down their joints and discs, as well as suffer from chronic pain overall. A herniated or worn down disc by itself does not cause symptoms, and as we mentioned, arthritis by itself typically does not cause symptoms either. But if the disc or bone spur pushes too far into the spinal cord, the nerves can become pinched off and irritated, which can cause pain, cramping, numbness, tingling, and in severe cases, weakness in one or both of the legs. So what separates a pinched nerve from conditions like muscular pain or arthritis is that muscular pain and arthritis will stay in the back, but a pinched nerve will cause symptoms to travel down one or both legs. A pinched nerve or spinal stenosis is best diagnosed by an MRI or CT scan. This is recommended only if someone is having pain, cramping, burning, numbness, or tingling in one or both legs that will not go away despite treatments such as physical activity. An MRI or CT scan is also recommended if there is weakness in one or both legs or loss of bowel or bladder function, because this could mean the spinal cord or its nerves are being severely pinched. It is common for symptoms of a pinched nerve to come and go. Because of this, some people can become scared of activities or exercise because they want to avoid the symptoms. The opposite is actually true. Inactivity and muscle deconditioning can make pinched nerve symptoms constant. That's why it's so important to pace yourself, to complete your pain diary, and to establish goals that are realistic. Pain Navigator will help you get there. The important points to keep in mind from this module are: the most common cause of chronic low back pain is constant muscle strain due to weakened, stress, or overused muscles. The next tier of most common causes of chronic low back pain are degenerative and due to wear and tear. Because this is typically a slow process and can be neutralized by the spine muscles, many people with these conditions do not have to experience pain symptoms. While we do not fully understand why many people experience chronic low back pain, we do know that the best way to manage symptoms is by improving spine health, in particular how you use your spine muscles. Improving posture, reducing weight to a healthy level, and increasing muscle strength and function are three of the most important ways to minimize the effects of chronic low back pain.
Are you ready for Pain Navigator?
Finally, an app that helps me manage my lower back pain around my busy schedule and not my doctor's.
This app has really been useful as an aid in my pain therapy.
I have chronic low back pain.
I have chronic back pain.
Pain Navigator is an easy-to-use chronic pain app that integrates first-line modalities into a program that you can complete virtually anywhere. For less than 30 minutes a day, you can get a better handle of your chronic pain and start enjoying your life again. Pain Navigator is the only chronic pain app that offers first-line evidence-based therapy and a progressive, customized program that will help you maximize your pain control.
The back is complicated. This app is informative and it's giving me tools to help reduce my chronic pain.
I was really skeptical about an app being able to help me with my chronic pain, but now I'm back on track with healthy coping.
Isn't it time you took a more active role in your pain management instead of just relying on your doctor, medications, and procedures? Are you ready for Pain Navigator? For more videos like these, sign up at painnavigator.io. Use program code WELCOME21.